The purpose of today's event was to showcase some really good practice in Wales. I guess one of the other kind of functions of today was to launch the special edition of the Journal of Integrated Care for Wales. We've got a story to tell in Wales about the work that's taking place, and a story to tell that can raise our own intellectual game in Wales about collaboration and integration.
My session used the metaphor of a garden to think about integrated care. What are the factors that we need to be in place in order to achieve the benefits that we hope to get from integrated care? So my key message would be that if we want to achieve the benefits of integration, we need to be clear about what the purpose of our integrated care initiative is. This needs to be connected with the local population, to think more than just money, but also think about clinical outcomes and social benefit. It needs to be something we're willing to work at to sustain over a course of time. We may get things right, we can make them better. Even if things don't work, we can recycle the learning and the ideas into future initiatives.
Our workshop today was about the work of the Regional Single Point of Access programme in North Wales, where we're creating a new streamlined way for adults and professionals across North Wales to gain access to information, advice and assistance. The core element of this is the integration of access to community health and social care services with strengthened links to the independent and third sector.
I think the key message that I'd like delegates to take away from our workshop today is that outcomes are really important, and what matters to people and finding out what's important to them is absolutely essential. And the only way that we can do that is to work together, and we need to continue to work together and become experts in the art of compromise.
Our workshop was how we in Gwent have worked together with several partnership agencies to improve the way we share information to children who go missing. The one key message I would say to people about working in partnership is that you can do it. It feels very difficult. It feels that a lot of people put it in the too difficult to do box, but we're living proof that it can be done. You can get over those hurdles, and it feels good.
I facilitated young people from Voices from Care talking about their experiences. So they spoke for the whole hour, talked to the audience about what the good and bad things about being in care currently in Wales. The young people's message was young people have a lot of strengths. Why do we always focus on what they can't do and the negative experiences in their lives? They have lots to offer, lots of aspirations, and let's start seeing young people in care as aspirations.
Our workshop was about linking statutory services with voluntary services and providing the link between the two as community coordinators, and it's to make sure that organisations throughout the county boroughs across Cymdeithas region will have the information and resources they need to provide individuals with the relevant information at the right time.
The unique selling point for our role is that we get to speak to individuals on a one-to-one basis, and as a result of speaking to that person on that one-to-one basis, we can determine what help and support we can work with them and give them to keep them healthy and active and not isolated within their community.
I think the key message from our workshop today would be that when we're looking now at people growing older and their health and their care, into older age, we must include the voluntary sector as part of health and social care to make sure that we're looking after that person to the best we can to do the best for them.
My workshop was about the value and the size of the contribution to the care economy that nursing homes provide, namely that there are 11,000 hospital beds in Wales and 22,000 nursing home beds. And my workshop was about the fact that those nursing home beds are not recognised properly when services are planned or commissioned. My one key message is that the people who provide nursing home beds, third sector providers, not-for-profit, for-profit, whichever they are, they need to be spoken to and included in the planning of healthcare for the people of Wales in the future. If we're to enable people to stay out of hospital and live as independently as possible, we need to have the services in the community that back that up, and nursing homes must be included in that planning.